Hi everyone, so we are here to discuss advocacy and especially global patient advocacy. We just finished the third International Headache Society Global Patient Advocacy Coalition Summit 3, where IHS members, physicians and patients met to discuss the current state and the priorities of advocacy. Dr. Rami Burstein, the president of the International Headache Society, opened the meeting emphasizing that most people in the world who live with headache diseases are not going to see a physician or a nurse. Hence the need for outreach, for education, and education to community workers, and also to help advocate for access to migraine-specific medications like triptans. And then my co-chair was Dr. Charway-Felli, if you want to add.
Sure. I think it is extremely important for us to open channels of communications at different levels, to different extents, across board. And first and foremost, to the person living with headache. I know a lot of people, especially in our regions, the Global South, as we are now known, where the individuals may not even know that there are things that they can access in order to have relief from their headaches. So it's education across board. So the general population knowing, identifying that there is a problem and it's not something to be ashamed of, for example, because I know a lot of people would be considered to be lazy because their headaches are so disabling. So it's knowing that it's a real problem and not just something they have made up in their heads, and that there are things that can be done to make the quality of life a lot better. But it's not enough to do that. Once the individual knows that they have to seek care, where is that care? So we need to educate the people that are supposed to provide that care across the different levels of healthcare provision. So from primary all the way up to tertiary, we all need education, and the education has to be constant so that we are keeping abreast with the changes in headache medicine and are able to provide appropriate care for our people living with headache, no matter where they are, no matter their socioeconomic status. They all deserve a better quality of life.
One of the things that really stood out to me from the summit was hearing from countries that, and this is something that I've been sort of involved in for almost 10 years now, and it was the first time I heard first-person accounts from Africa, from Southeast Asia, from Korea. And it was staggering, the different challenges that people face around the world. In many ways, there are local differences, but there's a lot of things that are that we have in common that are challenges that we face as as patients, and I think as well as providers.
Yeah, I was so touched by how openly patients share their stories, especially coming from places where the stigma is so high. You need to be so brave, and I think one of the things we can optimize, not for everyone because some rural areas don't have access to internet, but digital platform where people can support each other and share, but they can be anonymous too and see that people are there.
Yeah, absolutely. And I think that it's one of the things we take for granted. I mean, in Australia, in the US, I know this is the case, and there's lots of resources and people don't have to work that hard to find good information, particularly when you recognize that there's someone from the International Headache Society or from that local community. But that's just not the case in many of these other countries where, and you probably could speak to this better than I could, where they're having, I saw in South Korea, for example, they had a webinar and it had 100 people or so, and that's a great number for an early initiative. But there's probably hundreds of thousands of people that would be clamoring over if they knew that existed.
Absolutely, absolutely. I think, Olivia, must have been you that said this, not in today's summit, but in a previous meeting that we had, where you said that the onus on advocating for people living with headache cannot be placed solely on the shoulders of those living with headache. And that's absolutely right. Because sometimes they also need to be educated in how to advocate for themselves. Sometimes they don't even know that there's a need or an ability or that something can be gained from advocating for yourself. So it's all of us on every single level. Again, I have to keep pointing that out. On every level, we need to keep talking about this so that everyone understands that there are things that can, and not only can be done, but should be done.
I feel so strongly about that in so many ways, because already people with migraine or cluster are dealing with the severity of the disease. They're dealing with all the stigma. We cannot ask, I mean, anyone with any headache disease who want to come advocate, please, so grateful, but we cannot require them or put the burden on them. Mm-hmm. All of us has to be allies. All of us have to educate everyone. Like if we educate a school, it's everyone at school, supervisor, janitor, anyone. Same in the workplace, because they already are dealing with so much. I don't think it's fair, and I don't think it should be the case. And as you say, and they may have really negative repercussions too. Mm-hmm. I really understand that some people don't want to share the story because we know how high the stigma is and how it can have, unfortunately, very negative consequences for them.
Absolutely.
One of the things that that I had with my experience, having had chronic migraine and fortunately now being episodic, was that I saw a lot of different doctors. I would go through these sort of honeymoon periods where I'd be trying a new treatment, excited, thinking positively, would go well, and then the rug would be pulled from under me, and I'd go back to my sort of chronic baseline. But at that time, I was always leaning on the doctor as a patient with chronic migraine, and some people call themselves migraine warriors. At that time, I was a migraine victim. I was not a warrior. And we had the World Health, the World Federation of Neurology president talk to us about what advocacy meant, and he defined advocacy. And in that definition, he did include self. And so as someone who has migraine, I think that there is a certain amount of responsibility we have as someone who lives with migraine to recognize that you have a role to play in your own condition. And even if you're sick and unwell, it may not be your doctor, but it could be your partner. It could be your caretaker. It could be a family member. But you can bring people in to help you. You don't have to fight it alone. And I think that's an important message for people living with migraine.
I think the key in setting up support groups, which are also sorely lacking in our part of the world, is the acknowledgement that, I am not alone. Mm-hmm. There are other people who are going through the same thing, and that some of them know where the end of the tunnel is and can help lead each other towards the end of the tunnel. And again, it's a little bit different in different societies, but for many of our cultures, acknowledging disease is not, you can almost say it's taboo. And that makes it difficult to start these conversations. But when we normalize talking about these things, remove the stigma of acknowledging disease, etc., any disease, but now we're talking about headache, then that is the first step in going towards getting the things you actually need, so that it's not something that is keeping you back, but just something that colors you, that frames you, but is not you. So you are not the disease, or rather the disease is not you. You are something plus a little bit of disease that we will help you manage.
But you raise very important points, and not everyone can have World Federation of Neurology. I think doing any education program to community workers or outreach, it's important to not only teach how to diagnose headache diseases and treat them, but we have to teach providers or community workers how to educate patients for self-advocacy, for empowerment, so patients understand they can be part of a shared decision-making. It probably needs to also start the direct provider-patient relationship.
Yeah, I've been really fortunate to receive advocacy training in the United States as well as in Europe. And I think that there's a real diversity of knowledge in even the patient advocacy groups across the world. And to be able to showcase and give them a platform, I think, is a great first step. But I think there's more steps to take in facilitating and empowering those organizations to go on and do bigger and better things to help people within their communities in a more impactful way. because there's opportunities to do so, and we've got that platform to share that knowledge.
I think it's really important that we all, no matter where we feel we're on which level, it's a journey, and every single one of us is on that learning journey. The learning journey never ends. I think we get into a position of arrogance where we think, oh, I know it all. But we are all sometimes extremely humbled by the person living with the problem when they share their experiences. So we're learning from each other. And we have to not forget, absolutely, like you said, it is a partnership. It's not one person leading another person. It's a partnership, and we're all on the same journey. And the more the merrier.
Yeah.
There's an African saying, if you want to go fast, go alone. If you want to go far, go together. And I think advocacy is a perfect example of how, when you want to achieve something, the more partners you have on that journey, the better.
I couldn't agree more. I love that saying as well.
I love it. I want to post it behind us and everywhere. Yeah, it's so important. It's so important. I'm losing my train of thought. I'm stuck on this. But we all know we learn from patients. There's no way around it. And I think at every level, every single patient visit, and then I collect some information I get from them to share with other patients. And even during the summit, I feel like it was so eye-opening and inspiring to hear the patient stories. What I really like too is the Schlenterkit, what self-care of headache, I forgot exactly what it's called in Ireland, the program that was made by the Migraine Association of Ireland, trying to do migraine care with nurse-led clinics, involving peer support group in the actual migraine care and pharmacies. And I think it's in Thailand too, there is a More Pills, More Pain program involving pharmacies. Because in a lot of countries, patients may not make it to providers, but they go to pharmacies.
Absolutely.
So also including anyone in the community is very important.
Yeah, most of headache is treated outside of neurology. And that has to be the case, because there's just simply not enough neurologists in the world to treat every migraine patient. Totally. And a lot of people that are going to the pharmacy, I can speak for my geography in Australia. You can go to a pharmacy, you can speak to the pharmacist, and it's free. Yeah. It's a free conversation, and at least you get some level of medical expertise. In Australia, you need a 6-year degree to become a pharmacist. And so that's better than nothing, right? And being able to talk about the treatments you're taking, the quantity of treatments, the potential interactions that can help with that. So there is a role for that. And I think in terms of the education of GPs as well, that's paramount. That's where the bulk of migraine has to be treated. So to the extent that we as a neurology organization, as a headache specialty, can cascade our knowledge down to give confidence to GPs at that level everywhere, patients will be better off for it.
Yeah. So you raise a very important point about the pharmacist and the pharmacist's role also in migraine care. And I think we cannot forget that they are also an extraordinarily important stakeholder. And if we don't include them in that education process, again, the care will be suboptimal, because we know about medication overuse, headaches. I go to the pharmacist, I say I have a headache. The pharmacist says, here's some painkillers. And then before you realize it, you're eating more of the painkillers than you should. So the pharmacist also needs to be aware. And when we have a pharmacist dedicated to the community, then they are aware of the individuals that keep coming with the same problems. And they can also be part of the referral pathways that, you've been here too many times, maybe you should go see your doctor.
Yeah, absolutely. One of the things that, another thing that stood out was was from Professor Sakai, who spoke about the Fujitsu study, and just what an incredible case study that is in the workplace for an employer that has about 80,000 people. And the sort of statistic that he shared that really stuck out to me was the change in perception in that workplace environment about how migraine and headache disorders are perceived was just phenomenal. Yeah. I thought that was just a fantastic effort that we could replicate elsewhere.
Yeah, and I think it's very important the way it's done. And a lot of work and collaboration has been done for the Fujitsu Headache project, because it really needs to be at the entire level for everyone at the workplace. You cannot start trying to target a population. This was really from top down, all the supervisors at training, everybody participated in the program. This is also a legacy of different health promotion programs at Fujitsu, which I think helps. The more health promotion you do at a company, the more awareness you raise on the issues, and then they use dynamic content methods to keep it interesting. But here's a number you are referring. So 83% of people without headache change their attitude towards colleagues with headache disease as the result of the program. So that's quite remarkable. And just with education, we can make such a profound change in attitude. And migraine and headache disease are associated with decreased work productivity, but stigma itself is independently associated with decreased work productivity, so that we cannot not address stigma.
That was something that I learned actually. I didn't realize that stigma itself can contribute to lower productivity just by having a stigmatized condition.
I think the study also highlights something that we, those of us in positions where we can influence policymakers, we can't forget another crucial stakeholder in this whole process, and those are the governments and policymakers. If it's just in a corporation, but imagine for a government, for example, their human resource, the population, is their most precious resource. It's more precious than gold, diamonds, anything. And understanding how to get the best out of, not in terms of exploitation, but so that your population is as productive as can be, because you, the government or the corporation or whoever we're talking about, benefits from a more productive population. So it's in the interest of the policymaker to have policies in place to make the people as productive as possible. And a really good side benefit of that is that the person living with whatever they're living with feels better and is then able to be, I'm sure it does a great deal for self-confidence and self-awareness to feel like I am not a burden to anybody, not my spouse, not my child, not my parent, and I am a valued member of society. And I think that's extremely important across board.
So I haven't told many people this, but I left full-time work at Johnson & Johnson because of chronic migraine, and J&J to this day don't know that was the real reason why I left, because of migraine. And I went from someone who was a tax-paying citizen, productive, to someone who was leaning on the system and a toll and a cost because I was using public health benefits. And so I think the arguments for government are very clear around the ROI of being able to turn someone around, take them off disability, and bring them back into being a productive, healthier, happier, and contributing citizen again. So I think that there's absolutely a really strong case to be made at government of every level.
Absolutely.
The other thing about governments is that they're one of the biggest employers.
Yeah.
So you talk about a workplace, there are a lot of government employees in every country. There has to be for the administration of governance. And so that's a workplace that we can also target as well.
I mean, sorry.
No, go ahead. Just to add, I think some of us, those of us who are healthcare providers, have to learn to talk about our disciplines a little bit differently in a way that people can understand better. Especially when you're talking to the policymakers, we need to learn how to talk about the economics of our disciplines and specialties, so that it's not sounding like fancy things that nobody seems to understand. And as soon as you start talking, they just switch off. We need to speak a language that the person we're speaking to can comprehend. Yeah.
And not just the language, the argument. Yeah. Like when we talk to anyone, it's not it's not about what we are doing, it's what's in it for them.
Exactly.
What do they care about, and how can we reconcile so we can work together? Because when you say, oh, if you treat this disease, your productivity will be much higher. To me, that's a no-brainer. Maybe I have a huge bias here because I want everybody's migraine to be under control. But we have to use
see things from other perspectives
yeah.
and learn to speak in that perspective.
Yeah,
exactly.
And a great example of that, for example, when you're speaking to government, is they want votes. They want to continue to be able to do what they do. And when migraine affects 1 in 4 households, that's 1 in 4 potential votes that they could be receiving. So their constituents, their community, they have a vested interest in addressing this issue for those people.
Yeah.
Nerdy side of me, but I have to talk about a study. There were a study about education and management program in the workforce for Spanish postal workers. So someone managed to reach administration. So yeah, I think that's important, an important target. Sometimes it can be difficult because of the turnover. But I know some other headache specialists who are trying to work on that with the government.
Yeah, we haven't figured it out. There's a few people that are working on it, but I'm just really hopeful that if we are able to crack open migraine in the workplaces and address the burden of migraine with productivity, with its links to mental health, which is the flavor of the flavor of the year since COVID. Then imagine if every advocacy organization had a dozen or more corporate partners, and what that would do to the power and the impact of those advocacy organizations, whether that be patient or clinician-led. Yeah. I think it's just a huge opportunity where we could have a much broader impact if we could do that.
I think patients have to be at the center. Patients have to be at the center of every advocacy effort.
Absolutely.
Because we are advocating for patients. So it absolutely has to be patient-led. Maybe that's my bias and my pet peeve, but we talk a lot about migraine, and sometimes it's easier to do migraine in the workplace. I really appreciate it. It was a Fujitsu headache project, and 0.5% at cluster. Because oftentimes other headache diseases like cluster don't get talked about as much, but all the headache diseases are equally important and disabling.
Absolutely.
So I think we also have to keep in mind the other
So
headache
I will
diseases.
speak also as a general neurologist. I do think that no matter our focus, what's important is the spillover from those efforts, and the spillover is great. It will involve all of neurological disease, talk about brain health in general, and then once you're talking about brain health, you're talking about general health, you're talking about mental health, and as a result, with one seemingly simple act, the cascade of effects is going to be great. So it's really important that we don't forget. And again, for the International Headache Society, for example, I think the biggest impact we can have as a society is not to forget that there are so many levels we need to impact, from the very bottom all the way to the top, and not forgetting any single one, because any link in the chain that's broken will make everything not worth it.
Yeah, exactly. And that's part of the mission of IHS-GPAC is think globally, act locally, but partnering with IGAP and One Neurology to really all work together with all the neurological diseases, to break down the barriers in a collaborative way. I just want to, can you repeat again your quote I think we should end on
the African saying?
Yeah,
okay.
That would be a great end.
My pleasure. If you want to go fast, go alone. Question is, where are you going to end up? But if you want to go far, go together. So let's go together.
Exactly.
Fantastic. Sounds good to me.